Most adults over 60 ignore this subtle warning sign until it is too late to save their natural smile. You might think a little gum bleeding or a loose tooth is just a normal part of aging, but that is a dangerous misconception. Research shows that oral health is not just about your mouth. It is a gateway to your entire systemic health. When bacteria in your gums cross into your bloodstream, they don't just stay in your jaw. They travel. They reach your heart, your lungs, and even affect blood sugar control. Today, we are stripping away the myths to look at exactly what happens to your teeth as you cross the 60-year milestone. We will cover the mechanics of why your gums recede, why dry mouth becomes a silent enemy, and the specific daily habits that can turn the tide even if you have neglected your dental health for decades. Understanding this isn't just about avoiding a dentist's chair. It is about preserving your quality of life and your ability to enjoy the food and conversations that make life rich. Let's start with the anatomy of the problem. As we age, the tissues supporting our teeth undergo natural wear and tear. But why do some individuals maintain vibrant, healthy gums while others face rapid bone loss? The answer lies in a hidden battle happening in the microscopic gaps between your teeth and gums. If you think brushing twice a day is enough, you might be missing the most critical layer of defense. In the next few minutes, we will uncover why the conventional advice you've heard for years might be insufficient for the 60-plus body, and exactly what you need to change starting tonight. Let's address the most common mistake: assuming that pain is the first indicator of a problem. In the world of oral health, pain is usually the last stage. By the time you feel an ache or a sharp sensitivity, the damage to the underlying bone is often already significant. This is why many people in their 60s are blindsided by sudden tooth loss. They believe their teeth are fine because they don't hurt, while a quiet infection is slowly dissolving the bone structure holding those teeth in place. Think of your gums as the foundation of a house. If the soil beneath the house begins to wash away, the structure becomes unstable, even if the exterior walls look perfectly fine. Periodontitis, the advanced form of gum disease, works exactly like that. It is a chronic inflammatory response. Your body, in an attempt to fight off the bacteria dwelling in deep gum pockets, starts breaking down its own bone tissue. This is a scientific fact that many seniors overlook. The bacteria are not just living on your teeth. They're triggering a systemic alarm in your immune system. What many don't realize is that this state of constant, low-grade inflammation can contribute to systemic issues like cardiovascular stress. But the truly surprising part is how reversible this can be if caught early. It is not about perfect genetics. It is about disruption. We need to disrupt the bacterial colonies before they get the chance to colonize the root surfaces. If you have been ignoring that slight metallic taste in your mouth or the occasional sensitivity to cold, you're being warned. Let's look at why these signs are appearing now, more than ever before. Aging brings physiological changes that we cannot ignore. One of the primary culprits is a decrease in saliva production. Saliva is not just water. It is a complex, mineral-rich fluid that acts as a natural cleanser and a buffer against acidity. It is your mouth's primary defense mechanism. When we hit our 60s, many common medications, for blood pressure, cholesterol, or sleep, can lead to a condition known as xerostomia, or chronic dry mouth. Without adequate saliva, your mouth loses its ability to neutralize the acids produced by bacteria. This creates a playground for decay, particularly at the root surfaces of your teeth, which are exposed as gums naturally recede with time. This is where the risk of root caries skyrockets. Unlike the hard enamel on the top of your tooth, the root surface is softer and much more susceptible to decay. This is a subtle shift. You won't see a giant hole overnight. Instead, you might notice a slight yellowing or a notch near the gum line. If you are experiencing dry mouth, you're operating with one hand tied behind your back. But there are ways to mitigate this. It isn't just about drinking water, though that helps. It is about stimulating natural flow and using the right oral care products that don't rely on harsh, drying chemicals. We will discuss specific tools in a moment, but first, you need to understand the connection between your diet and these hidden changes. What you eat is the fuel for the bacteria, and shifting your habits can effectively starve them out. When we talk about nutrition for the 60-plus age group, most people think about heart health or weight management. Rarely do we hear about the impact of diet on the microbiome of the mouth. The bacteria that cause gum disease and decay feed on refined sugars and simple carbohydrates. These are not just cookies and candies. These are hidden in many processed foods. When these sugars stick to your teeth, they provide a feast for the bacteria. They produce acids as a byproduct, and those acids are what dissolve your enamel and inflame your gums. But here is the secret that most people miss. It is not just about what you cut out, but what you add in. Fiber-rich, crunchy vegetables act as a natural mechanical cleaner. When you chew raw carrots, celery, or apples, you are stimulating saliva production and physically scrubbing the tooth surface. It is a form of nature's toothbrush. Furthermore, maintaining a high level of calcium and vitamin D is crucial not just for your hips, but for the density of the jawbone itself. The jawbone is dynamic. It is constantly remodeling. If you are deficient in these key minerals, your body may steal them from your jaw to support other vital functions. This is a crucial, often overlooked physiological trade-off. Ensuring you have adequate intake of leafy greens, dairy, or fortified alternatives is a fundamental pillar of oral health. But there is another factor that is just as important as nutrition. The mechanical side of cleaning. Most people over 60 use a toothbrushing technique that was correct when they were 20, but it is not working for them anymore. Let's talk about the mechanics of cleaning. Many people believe that scrubbing harder with a firm brush is the best way to clean. In reality, this is one of the most common causes of gum recession. Using a firm brush and a horizontal, sawing motion wears away the delicate gum tissue and can even notch the teeth at the gum line. This is a classic case of too much of a good thing, leading to damage. The goal is to be gentle but thorough. A soft or extra soft toothbrush is almost always the better choice. It allows you to reach the gingival sulcus, the tiny gap between the tooth and the gum, without causing physical trauma to the tissue. You should be using a technique that focuses on a gentle, circular motion, angling the bristles at 45 degrees toward the gum line. This is where the bacteria hide. If you aren't cleaning that specific area, you are essentially leaving the engine room of the infection untouched. And what about flossing? If you have dexterity issues, traditional string floss can be a nightmare. But the science is clear. Interdental cleaning is non-negotiable. If you find flossing difficult, there are modern alternatives like water flossers or interdental brushes that can be far more effective and easier to use. These tools are designed to flush out the debris that your toothbrush simply cannot reach. Ignoring the spaces between your teeth is like cleaning your house but leaving the hallway untouched. It is where the most persistent plaque builds up. Now, let's address a sensitive but vital topic: the role of regular professional maintenance. As we age, our dental needs become more complex. You might have dental work done years ago, crowns, bridges, or fillings, that are now reaching the end of their lifespan. These restorations do not last forever. They can develop microscopic gaps where bacteria can infiltrate, leading to decay underneath the very structures intended to protect the tooth. This is why regular checkups are not just about finding new cavities. They are about evaluating the integrity of your past dental history. A professional cleaning is also the only way to remove hardened plaque, known as calculus or tartar. Once plaque calcifies, it is like concrete. No amount of brushing or flossing will remove it. If this calculus is left on the teeth, it acts as a constant irritant to your gums, perpetuating the inflammatory cycle we talked about earlier. Many seniors skip these visits because they feel their mouth seems fine. But that logic is flawed. The goal of a dental visit is to stop problems before they manifest as pain. It is an investment in prevention that pays off significantly. Think of it as a maintenance check for a vintage car. You wouldn't wait for the engine to fail before checking the oil, would you? The same principle applies here. In the next section, we will discuss how to identify the early warning signs of trouble before they become expensive and painful procedures. You might be wondering, what exactly should I be looking for in the mirror? It is not enough to just look for cavities. You need to inspect your gums. Healthy gums should be firm, pale pink, and fit snugly around the teeth. If you see swelling, redness, or if the gums look like they are pulling away from the teeth, those are red flags. Another often ignored sign is bad breath that doesn't go away after brushing. This is frequently a byproduct of bacterial activity in deep pockets or on the back of the tongue. Don't mask it with mints. Investigate the source. Also, pay attention to any changes in your bite. Do your teeth feel like they are shifting? Does your jaw feel tired in the morning? These can be signs of bruxism, or grinding and clenching, which is a common stress response. As we get older, our teeth are more prone to microfractures, and clenching can turn a small crack into a major problem. If you notice any of these signs, it is time to have a professional look at the underlying cause. But don't let this alarm you. Knowledge is your greatest tool for control. By recognizing these signs, you are ahead of the curve. You are no longer just reacting to pain. You're proactively managing your health. We will now look at how to build a routine that covers all these bases without turning your life into a series of chores. Creating a sustainable oral health routine is about consistency, not intensity. It doesn't need to take an hour. In fact, it should take less than 5 minutes twice a day. The key is to make it a non-negotiable part of your morning and evening, just like taking your medication or getting dressed. Start by selecting products that work for you. If you have sensitive teeth, look for toothpaste designed for sensitivity. But make sure it also contains fluoride. Fluoride is the gold standard for remineralizing weak enamel and preventing root decay. If you are worried about the taste or the ingredients, there are many medical-grade options available. The sequence of your routine matters too. Always start with interdental cleaning. Whether that is water flossing or using small brushes to dislodge the plaque. Then, follow with brushing. Why? Because if you floss after brushing, you are just pushing the loosened debris back onto your clean teeth. By flossing first, you remove the bulk of the bacteria and food particles, allowing your toothpaste's active ingredients to reach the surfaces of the teeth more effectively during the brushing phase. It is a small change in sequence, but it makes a massive difference in efficacy. And remember, spit, don't rinse. After you brush, spit out the excess foam but don't rinse your mouth with water. Leaving that residue of toothpaste on your teeth allows the fluoride to work for the next few hours. This is a scientific fact that many people overlook. Let's touch upon a topic that is often hushed. The connection between systemic diseases and oral health. It is not a coincidence that people with diabetes often struggle with gum disease. High blood sugar levels create an environment where bacteria thrive, and the body's ability to heal is slightly compromised. This is a two-way street. The infection in your mouth can actually make it harder to control your blood sugar levels. If you are managing a condition like diabetes or heart disease, your oral health is not just extra care. It is an integral part of your disease management plan. You must communicate with your doctor and your dentist. They should be working as a team to support your overall health. Many people think these are separate worlds. But your body is a single, interconnected system. Neglecting your mouth is neglecting your heart and your metabolism. What many seniors don't realize is that even minor improvements in oral hygiene can have measurable impacts on markers of systemic inflammation. It is a powerful realization. You have more control over your health destiny than you think. By simply keeping your mouth healthy, you are removing a significant load from your immune system. We have covered a lot of ground, but the most important part is how you apply this information starting today. There is a pervasive myth that losing teeth is an inevitable part of aging. I want to tell you clearly, it is not. While it is true that aging makes certain conditions more likely, tooth loss is almost always the result of disease, not the passage of time. If you look at people in their 80s and 90s who have retained their natural teeth, they share one common trait: a dedicated, lifelong commitment to oral hygiene and regular professional care. You can still change your trajectory. It is never too late to start a better routine. Even if you have already experienced some gum recession or have some restorations, the goal is to stabilize the current situation and prevent further decline. Think of it as protecting the assets you still have. The cost of prevention is a fraction of the cost of restorative procedures like implants or bridges. But beyond the financial aspect, think about the freedom of eating whatever you want, the confidence to smile, and the ability to speak clearly. These are the joys that oral health protects. As you go about your week, I want you to pay attention to your mouth. Note the small things. How do your gums feel? Is there any sensitivity? Does your mouth feel dry? These observations are the data points that will guide your next steps. Before we conclude, let's summarize the pillars of health we have discussed. First, acknowledge the importance of saliva and address any dry mouth symptoms with your healthcare provider. Second, prioritize interdental cleaning to prevent the buildup of plaque in those hidden spaces. Third, use gentle, effective brushing techniques to protect your gum tissue. Fourth, nourish your body with the right minerals to support your jawbone density. And finally, don't view the dentist as an adversary, but as a partner in your ongoing wellness. If you have been hesitant to schedule an appointment, let this be the signal to pick up the phone. It is a simple step, but it is one that can alter the course of your health for years to come. You have the knowledge now. You understand why the conventional wisdom is being challenged by modern science. The only thing left to do is to put this into practice. It starts with your next brush, your next meal, and your next choice to take care of yourself. You are not just brushing your teeth, you're protecting your life. As we wrap up this deep dive into your oral health, remember that your actions today build the foundation for tomorrow. You don't need to change everything at once. Pick one habit from this discussion. Perhaps it is the order in which you floss and brush, Or maybe it is the extra glass of water to combat dry mouth. Start there. Master that habit, and then add another. The cumulative effect of these small changes will be profound over the coming months. You deserve a healthy, functional smile. And you are entirely capable of achieving it regardless of your age. Thank you for taking this time to invest in your own well-being. If you found this information valuable, consider sharing it with someone who might benefit from this perspective. It could be the wake-up call they need. Keep listening to your body, keep questioning what you think you know, and prioritize the health that sustains you. We will continue to explore the science of longevity and practical health management in future discussions. Until then, take care of those small details that make a massive difference in your daily life. Your smile is worth it.